The UAB Child Neurology Residency Program is an ACGME accredited categorical residency program here at UAB. We have 2 categorical residency positions every year. We've been accredited since 1988 and have a long history of working very well with the UAB Pediatrics Residency Program, which also supports our residents, and the UAB Adult Neurology Residency Program, which also supports our residents.
What's unique about our program is that we're the only child neurology training program in the state of Alabama. Children's of Alabama is the freestanding hospital, the only one for children's in the state. So we see all types of patients.
For residents who come here, we guarantee them a varied experience and a wide variety of patients that they'll be able to see. We take our teaching very seriously. The goal is to grow and develop competent, excellent academic and private practice child neurologists, and we've done that.
Our residency is a combined residency, so it's a 5-year program. The first 2 years are general pediatrics, so you're with the other general pediatrics residents just doing what they're doing. Your 3rd year is an adult neurology year, and that is also when you start to have some child neurology exposure with your own fellows continuity clinic. And then the 4th and 5th years are meant to be fellow years in pediatric neurology.
We want people who are engaged and ready to learn. The program itself is one that they spend about half their time in the hospital doing the inpatient service, which is very busy, and then the other half is spent taking advantage of all the outpatient services that we have.
We definitely want our trainees to have a well-rounded experience. We have approximately 22 faculty members. We've grown quite a bit in the last decade who are very invested in our trainees. We have a very busy clinical presence in the state of Alabama. So at UAB Child Neurology, we really love seeing patients, and in 2020, despite the COVID-19 pandemic, we actually had more than 10,000 outpatient encounters, of which more than 4,700 of those were telehealth encounters, and we also had more than 4,000 inpatient encounters. So we're definitely here to serve the people of Alabama, the people who travel all over the Southeast to come and see us here at Children's of Alabama in Child Neurology.
This program really spoke to me because of its clinical base and being able to see a wealth of different types of patients.
I think one thing that really stands out is the people that you get a chance to work with. Not just the attendings, but our nurses, our staff, our office managers, our schedulers, they're all working in your best interest. They're all available for you at any time.
One of the things that I really liked about the program was that there were multiple specialists in multiple different fields of pediatric neurology, and usually not just one, but 2 or 3, which makes learning extra interesting, learning from the experts.
I would stress the fact that, again, we take this seriously. We want to train people in an effective way and in a supportive way.
We see a huge variety of patients, both inpatient, we're taking care of very sick patients in the ICU, and then we also have outpatient clinic where you're taking care of healthier patients who are clinically stable, and so you get this wide spectrum of healthy outpatient patients to very critically ill patients.
They all pass their boards, and they all end up pretty much where they wanted to go, whether it is in private practice or in doing another fellowship or taking on a faculty position. And so again, we feel like that our ability to get residents towards that next step has been very good.
Your clinical training is going to be excellent. So by the time you graduate, you are going to feel comfortable taking care of basically everybody. And that's one, because we have a very high patient load, but also because we have a large number of subspecialists here as well. And so you can spend time working with our neurogeneticist or our neuromuscular specialist and really get more subspecialty training with each of those neurologists.
I think that we all come together around that common goal, and that's to care for kids, and that our passion is to care for kids.
We have a large faculty base that's very diverse and all have their own unique interests, which can be very invigorating for a residency program. If you're looking for a program that will allow you to become a well-rounded, very competent child neurologist, I think that an applicant finds that here.
That's one of the real strengths of our program, is that you will see everything more than once. you'll see everything. And we have the experts here to be able to help guide you in that learning, in that care of those patients.